Okay, the MGB is great, right? Cures diabetes, high blood pressure, sleep apnea, pain in the knees, all kinds of good things. What is our claim for depression? What's the claim for the impact of the MGB on depression? Well, here's the scoop. First of all, to understand what we claim for our impact on depression, you need to understand that most psychiatrists differentiate two flavors of depression. One is, I'm depressed because something awful happened to me. I was shot. Someone died. I lost my job. Something like terrible tragedy happens. If you're sad after that, that kind of makes sense. And if you're depressed by a situation, it's called situational depression. Now, you could be depressed even though everything's wonderful. You could be a millionaire, you could be a TV star, a movie star, you could have everybody love you and still be sad. In that case, the theory is maybe there's something chemically wrong in the brain, and then an antidepressant chemical can be helpful, because that's not situational depression. It's now called either non-situational or clinical depression. Okay. Now, let's take our patient. Our average patient's a 39-year-old woman who weighs 300 pounds, who has diabetes and hypertension. And when we operate on her, a year later, she weighs 140 pounds less. She's not diabetic. She doesn't have hypertension. She doesn't take all those medicines. And if she was depressed because of that situation, we wouldn't be surprised if she felt better. On the other hand, we could give her $1 million and cure her diabetes and elect her president and send her to the moon and make her, and still she could be depressed if she has a chemical imbalance. Now, there is a possibility that our hormonal changes will affect that. So what we say to our patients is, number one, there is a chance that we can improve your depression. When we survey our patients post-op, a lot of people are depressed pre-op when we ask them about it on their pre-op surveys. And many of them get better. But we never want to stop it around the time of surgery. We want to say, wait 6 months or a year, then visit with your doctor and discuss the diagnosis. Is it situational or non-situational depression? And should we try tapering this medicine to see if it's safe? You never, and into the camera, never stop your antidepressant. What I'm trying to say is, and a lot of people get that in their head. They say, oh, I stopped my blood pressure medicine. I guess Dr. Rutledge wants me to stop my antidepressant. And so today, looking into the camera, no!
Okay, so it wasn't that I forgot. I'm serious until now.
Don't forget either.
Okay.
Tie a string around your finger.
Yes.
Talk to your husband.
Now, do I
write it on your wrist.
I need the patch? Is that what you're saying?
No. Okay, now what about the patch? Many people get depressed after surgery not because of anything other than a change in hormones. So I'd like to talk to you for a second about something called postpartum depression. Okay? That's someone who delivers an otherwise healthy baby and gets sad and depressed and may even be suicidal postpartum, after delivery. That doesn't make any sense. There's no way to say the woman participated in the miracle of life. There are lots of miracles. That's it, the top. And a healthy baby and be sad. There's no way that makes any sense. Except there's a sudden drop in estrogen, and that affects some people. Okay? In our patients, they do well, and sometimes they're sad post-op, not related to stopping their medicines. They continue their medicines but may be sad because their estrogen drops precipitously right after surgery. Just like if I told you as a smoker to quit smoking, and you said, okay, I would be happy that your smoking had stopped and your risk long-term of lung cancer, emphysema, bronchitis, heart attack, stroke, and death had gone down. I just wouldn't want to be near you when you quit. Now, some people can quit smoking and it doesn't bother them. But some people quit smoking and they're heck on wheels. Okay? In the same way, our female patients, when they drop their estrogen post-op, may be fine. But sometimes that drop in estrogen, like postpartum depression, can devastate a woman after our surgery, even though the surgery itself has gone well. And the estrogen patch can help as a transient treatment, just like a nicotine patch can help you if you're quitting smoking. So your question is, first, take your Prozac. First, take your Prozac. First, take your Prozac. Second, see if you have cravings or crying or tearfulness or things like that. If you do, then you may consider the patch.
Okay.
But first, right.
Got it.
How long do you take the Prozac for?
We recommend that if you're on an antidepressant, you don't stop it acutely. We stop the blood pressure medicine and a lot of things suddenly. We have tested this out, and stopping an antidepressant suddenly after surgery can be terrible.
But if you've never been on antidepressant?
Then we want to put you on one. No.
No, you don't need a Prozac. Or you do have to take Prozac?
No.
No, okay.
If you are on an antidepressant when you come to see me. Yeah. Only if you're on. If you look in the manual, it doesn't say start taking an antidepressant.
Sorry.
That's okay. But I don't want to misunderstand. So don't start taking it if you haven't.
Okay.
But if you have been taking one for how many years?
3 months.
For 3 months? Oh.
Mine's situational because I have everybody living in my house.
Mother, son, daughter,
Grandson, dogs.
Don't stop it.
Yeah, I asked them when I went to the doctor, I said, is it normal?
Can we have a vote? All in favor? All opposed? Okay.
Get rid of them.
And we're building, and they're building a brand new house on our farm. So yeah, and I'm the contractor.
Don't stop it.
Yeah, I know.
Am I right?
God.
Yeah, okay.
I
All right.
just
good.